Hi, I'm Chelsea and I'll be doing a video critique of reduction in central line associated bloodstream infections by implementation of a post-insertion care bundle. So what is the clinical problem? The article stated that central lines associated bloodstream infections, or CLABSIs, are associated with increased length of hospital stay and cost as high as $29,000 per episode. The estimated annual cost of CLABSIs to the healthcare system in the United States is $2.3 billion. What is the research question? There actually was no research question stated outright in the article at all. The purpose of this study was to implement a post-insertion care bundle to address the high CLABSI rate that remained despite the previous implementation of an insertion bundle. What was the study design? A line care bundle was developed by the nursing staff and implemented by each unit's IV champion. The bundle consisted of daily inspection of the insertion site care if the dressing was wet or soiled or had not been changed for 7 days, documentation of the ongoing need for the catheter, proper application of a CHG impregnated sponge at the insertion site, performance of hand hygiene before handling the IV system, and application of an alcoholic scrub to the hub for 15 seconds prior to each use. A 4-hour hands-on training in techniques for accessing and caring for all IV catheters was mandated for all nursing staff, and each nurse was required to demonstrate competence in catheter insertion site and hub care. What was the setting of the study? So it was the Department of Veterans Affairs Medical Center in Denver, which is a university-affiliated acute care teaching hospital with 5,000 admissions and 38,000 patient days per year. How was the sample obtained? Surveillance for CLABSI was conducted by trained infection preventionists using NHSN case definitions and device day measurement methods. Surveillance of all bloodstream infections has been performed continuously since 1993, with reporting of cases per 1,000 patient days from 1993 to 2005. Until 2006, ICU nurses began collecting and reporting device days to infection prevention and control. And then after a 6-month pilot phase, during which staff gained experience with device day monitoring, data collection for the study began. Was the sample size adequate? The study doesn't mention actually whether or not the sample size was adequate, or they didn't say that there was a number needed to treat. How did the researcher collect the data? So they actually used surveillance. It was conducted by 4 certified infection preventionists. They reviewed the medical record of every patient who had positive blood cultures. Then each case was reviewed by the hospital epidemiologist. What instruments were used? It wasn't necessarily an instrument, but they applied the definition of CLABSI to each of the cases. So the National Health Safety Network's definition of CLABSI was, so there's 2 criteria. The first criteria is the patient has a recognized pathogen cultured from 1 or more blood cultures, and the organism cultured from blood is not related to an infection at another site. And then the criteria 2 is patient has at least 1 of fever greater than 38 degrees Celsius, chills, or hypotension. Positive laboratory results are not related to an infection at another site. And common skin contaminant, i.e. diphtheroids, bacillus species, propionibacterium species, coag-negative staph, including staph epidermidis, viridans group streptococci, Aerococcus species, Micrococcus species, is cultured from 2 or more blood cultures drawn on separate occasions. Were the instruments valid? I just said not applicable. Were the instruments reliable? Again, not applicable. What statistical procedures were used? Statistical analysis were performed with GraphPad Instat 3.0 using Fisher's exact test for comparisons of proportions. What were the results? During the pre-intervention period, there were 4,415 documented catheter days and 25 CLABSIs for an incidence density of 5.7 CLABSIs per 1,000 days. After the intervention period, which was after the introduction of the post-insertion care bundle, there were 2,815 catheter days and 3 CLABSIs for an incidence density of 1.1 CLABSIs per 1,000 days. Relative risk for a CLABSI during the post-intervention period compared to the pre-intervention period was 0.19 with a p-value of 0.004. And this is just a table showing all of the results in table form, or all of the different CLABSIs that they had seen, including the case, which nursing unit it was on, what the patient's diagnosis was, what the pathogen they found in the bloodstream infection, and then the dwell time of each of the catheters. Were the results statistically significant? Yes, and the researchers even made an adjustment for the possibility of incomplete catheter day ascertainment during the baseline period. So a calculation was made to estimate the number of catheter days in the baseline period had the utilization proportion been equal to that in the post-intervention period. So when you compare the incidence densities, the intervention remained significant at 0.23 with a 95% confidence interval, and the p-value was 0.017. Were the results clinically important? Yes, the implementation of a post-insertion care bundle was associated with a significant reduction in CLABSIs.